Uh, a couple of quick announcements before we really begin. And just to introduce myself, my name is Madeline Sabatoni. I think I've talked to a lot of people via email or on the phone. I am the program officer for serving the Medi-Cal Health Navigator program at the Center at Sierra Health Foundation. And it's such an honor to be able to kick off this program here with you today. And I am so happy that we're finally able to all come together under the 4 counties that we're serving for this program. And as you all know, those counties are Amador, Calaveras, Lassen, and Solano. So thank you all again for being here today. I just want to note that we're recording this session. So my hope is that you all have access to some of this information again if you need to go back to it. But I do want you to know that we are recording. And then my colleague Gina Yang has joined us today, and she can assist with technology issues and other things. And so if you're really having a technology problem, you can chat Gina in the text box, and her and I will troubleshoot those problems together. We have a whole team here today to help us work through a number of items on our agenda. So we'll introduce people as they come forward. But first, I would like to introduce you to Kai-Ying Heng. She's our Vice President of Programs and Partnerships here at the Center at Sierra Health Foundation. Heng, I'm going to pass the mic to you.
All right. Thank you, Madeline. Can you all hear me? You can hear me. Okay, great. I'm using both audio by phone as well as my laptop. Well, it is so good to finally bring this group together. We've been waiting patiently to be able to assemble all of you. So we're excited that we now have a complete cohort. And we're just absolutely thrilled that there are so many of you who are able to spend your afternoon with us. As Madeline said, I'm Kai-Ying, and I have the pleasure of serving as the Senior Vice President for the Sierra Health Foundation and the Center Sierra Health Foundation. And the Medi-Cal Health Navigator Project is a project of the Center Sierra Health Foundation. And for those of you who don't know us, we are, as Sierra Health Foundation, we are a foundation with primary focus on health. And for us, we take a very broad view of health. So it is not just about healthcare access, but it's about all of the different determinants of health that impacts the health status. And so for those of you who've been in the work and in the world of Medi-Cal outreach and enrollment, you know that it is not just about access to, right, healthcare and health services, but it's actually use of as well. So these are certainly interesting times that we live in, and we know that COVID-19, the health and economic consequences has resulted in what we've already seen, a spike in terms of Medicaid, Medi-Cal enrollment, and that is certainly true. We are just so thrilled to be able to have all of you be our partners in this work. Many of you have been doing this work for a very long time, not just about making sure that there's access to health coverage, but really able to help your community and the vulnerable families that you work with to be able to make use of the health coverage and health insurance that they now would have access to. So we're leaning into your expertise. Some of you are new to this work as well, and that is why we are looking forward to bringing you all together for a kickoff. And then as Madeline will share with you later on, continually bring all of you together for peer-to-peer learning and sharing. That is our commitment. That is who we are at Sierra Health Foundation. We believe that once you are part of our family, you are part of our family. That means we have the opportunity to learn together. So we're really excited about that. We know that these are going to be tough times in the time of COVID, that what we are asking you to do in terms of Medi-Cal outreach and enrollment may not necessarily look the same for those of you who've been doing this work for many years. And so in these times, it's going to require new tools, new techniques, new approaches to doing so. And it is our commitment to you to provide a space for the sharing of what these best practices would be in a time of COVID. So again, thrilled to have you be part of this group. I think we're going to be working together for the next, year or so. We're going to learn a lot together, and just really thrilled to be able to have all of you be on board. So Madeline, I will stop here unless you would like me to introduce our next speaker.
Thanks, Tying. And we were going to have our partner from HCS join us, but I think that she is having some connection problems, so she's not on the Zoom right now. And so I'm going to just go ahead and jump ahead to let everyone else introduce themselves and do our icebreaker activity. And when and if Jocelyn's able to join us, then we will turn it over to her. So I want to give you all, one of our goals today is really for you all to get to know each other, and so we can foster that peer network. And so we're going to start with an icebreaker activity. And at first I'd like you all to just be able to introduce yourself, your name and your role in your organization. And then we're going to do a little bit of an activity we call Head, Heart, and Feet. So so it's, what am I thinking about this project? How do I feel about the project? And then what do I want to take away with me? What are my action steps? So I am going to, I will just kind of let you round robin it, and I'll start with our partners at United Way of Northern California, because Teresa, I see you, you're the closest to me. So if you want to go ahead and then introduce yourself, that'd be great. Teresa, I think you're still muted.
Sorry about that. My name is Teresa McCausland, and I'm the Director of Community Impact Programs here at United Way of Northern California. And right now I'm thinking basically an open mind to, and hopefully to learn from this group any tips or best practices that will help us be successful with the project. And that makes me feel, comfortable that there's enough support available.
Is anyone else from your team here with us today?
Yes,
Teresa?
Camille.
Why don't we
Smith.
pass to Camille?
Hey, good afternoon, everyone. Camille Smith with United Way of NorCal. I'm a program assistant with the Community Impact Department. I agree with Teresa, same thing. Staying positive about the move forward with this project, and just want to hear what everyone has to say, and kind of learn from everyone that is, working on this Navigator project together. So basically the same thing. Ditto.
Thank you, Paul. Thank you, United Way of Northern California. I'm going to pass it over to Elba and your team with Napa. Do you say Napa Chai? Do you say Napa CHI? What is the?
Well, it depends. I guess if you're thinking of your chai latte, people go with the Napa Chai, and either way, or Napa CHI, Napachi, lots of names. Good afternoon, everybody. Elba Gonzalez Mares. I'm the Executive Director of Community Health Initiative, Napa County. I think what I'm excited about is that this is the opportunity we've been waiting for, in terms of conducting work in a neighboring county of ours that we've already been doing lots of effort. And so I'm just excited about this opportunity to really kind of give us that extra push to get us going. So I'm just feeling really excited and can't wait to keep moving forward with it. And I do have my team here. I'll have Katie go first.
Hi, I'm Katie Tierney. I'm the Finance and Operations Director here at CHI. And I think this is a really great opportunity to offer assistance in our neighboring county, in Solano County, where there's essentially no help there for these vulnerable populations. So I'm feeling excited about it, and I, would like to walk away today with any ideas as to how to make it, go smoothly. So, Maria?
Hey, Katie. Hi, everyone. My name is Maria Torres Almanza. I'm the program director at Napa CHI. What am I thinking? Let's see. I'm ready to help people in Solano County. I feel excited about it, and what I'm taking away with me is, getting to meet all of you and getting new ideas for this project. And that's all from our team.
Thank you. I'm going to pass it over to Joe with the Amador Tuolumne Community Action Agency, and you and your team, if you want to introduce yourself.
Yeah, hi Madeline and everybody else. So I think I've already been introduced there, Joe Bors. I'm the Executive Director of Amador Tuolumne Community Action Agency, which is a bit of a misnomer, though we are a branch of the county government in those two counties. We also serve Calaveras and Mariposa counties as well. But Madeline asked and Kai-Ying asked if we could support both Amador and Calaveras, and since we have a presence in both of those counties, I'm pleased to do this, and I think we're uniquely qualified because of the other programs that we also support, where we're taking information from a couple of thousand clients a year that we see, and we're always asking them the question of, are you on Medicare? And checking a box, and so. Though we've never been a part of, that I'm aware of anyways, our agency, which is almost in its 40th year, and I've only been the ED for a year and a half, I'm not aware of us performing this kind of a service, at least in the two counties that we're going to be doing it in now. So I'm excited, and I can't wait to get started. And I will introduce our project manager for this project, and that's Patrick Kane.
Unmute, right. Hi, Patrick Kane with Amador Tuolumne Community Action Agency. And I am, thinking that, well, I keep wanting to say I'm thinking that I am excited, but I guess that's a feeling. So we'll say that I'm excited about this, to learn new things about this program. I haven't done this area of work before, so this will be new to me. So I guess I'm thinking, what's new to me here? What is there for me to learn in this? And then what am I taking away with me? What is new to me, and then how to implement that and really get started on this. So yeah, thank you very much. And I believe that's all of us.
Thank you both. And then I'm going to go to Lori and your team with Nexus Youth and Family Services.
Good afternoon, everyone. My name is Lori Halverson, and I am the the programs director at Nexus Youth and Family Services in Amador County. We also have services in Calaveras County. So like ATCA, we will be working in both counties, both Amador and Calaveras. What I'm thinking about this is that we're really fortunate to be able to have a partnership with Sierra Health Foundation. We haven't been able to work with you before, and I feel very fortunate for that. And the takeaway that I would have is that it sounds like there are a lot of folks on this call who have experience, and we're ready to learn from what everyone else already knows, so we don't have to reinvent the wheel. And I will pass it to Yvonne Isaac.
Okay. Hi, my name is Yvonne Isaac. I'm the program manager. And what I'm thinking, I'm just like everybody else, I'm excited to work with everybody else, and I'm excited about this new program. I just, the other thing is I like, one thing that I can take away would be like learning some new tricks and tips to be able to reach out more folks in the rural community. Thank you. And Gloria's right here with me, but she's having technology difficulty.
All right. Is there anyone else besides Gloria? I'm sorry, we can't hear from you, Gloria, on your team.
No, that's us, the three of us.
Okay, great. And then I just want to make sure I introduce you to some colleagues of mine at the center, and then I'm going to introduce our partners at Transform Health. And then it looks like Jocelyn from the Department of Healthcare Services was able to join us, and so then we'll, once we finish these introductions, I'll let her introduce herself and tell us more about the Medi-Cal Health Navigator Program from the Department of Healthcare Services. So first, I want to give you an opportunity to meet both Noemi and Gina at the center. So Noemi?
Good afternoon, everyone. I'm Noemi Avalos, Evaluation Officer at Sierra Health Foundation in the center. It's a pleasure to meet you all. I'm the evaluation lead for this project, supporting Madeline and the rest of the team with reporting to DHCS and also managing the external contract that we have with Harvey Evaluation, our data consultant. Thank you.
Thank you. And Gina, just you want to say hi?
Yeah, good afternoon, everybody. My name is Gina. I'm a program assistant at the center at Sierra Health Foundation, and I'm supporting Madeline today with all the tech stuff. So chat me if you guys need anything.
Thank you, Gina. And then I want to give an opportunity for our partners at Transform Health to introduce themselves. Lisa, would you like to kick us off?
Sure, happy to. And it's really great to see you all. Many old friends and new faces. It's really great to be here with you. My name is Lisa Chanson. I'm the CEO and founder of Transform Health. We're a national women and minority-owned consulting firm working in the health systems transformation space. And outreach and enrollment is a key critical body of work for us. It's something we believe in, and we've been supporting on the national scene as sisters enrollers for the last 4 years on more of a pro bono basis, because this has been an area where federal funding, state funding over the last couple of years have gone down significantly. We're really excited to be able to be here in support of Sierra Health Foundation. We hope to be able to engage with many of you and bring many lessons that best practices and lessons learned both on the national stage as well as, learn from you all. Our healthcare is local. And so at the end of the day, it's individuals and organizations like yours that's really being able to move the dial and change people's lives. It is impossible, really, it's really hard to fund access to healthcare services as well as social services if you can't get into the appropriate coverage program, if you don't have insurance, if you're not on Medi-Cal. And so kudos to organizations like yours for picking up this work, because it is absolutely critical when we talk about keeping communities healthy. I'm gonna take a page out of Madeline's suggestion for the icebreaker and share with all of you what I'm thinking and feeling and taking away, because I think this is a really important moment. With the Biden administration, I'm thinking a lot about the new opportunities ahead, particularly around sustainability of this work. I just got off of a webinar with that was with a national expert talking about what we might be able to expect from a Biden administration, and outreach and enrollment is going to be one of his priorities, which is really, really encouraging and great to hear. It makes me feel very optimistic for our work ahead. And, you know, like one of the key takeaways for me is we're gonna have some challenging times, but together, if we're actively supporting each other and building this community, we can get through this and we can all thrive. And so I'm really excited for what can come next. So it's great to see you all and be here. Thank you. I'm gonna pass it over on to Heather Bates, who is our VP of Stakeholder Engagement. Heather.
Hi, everyone. It's a pleasure to be here. I'm loving all the familiar names and faces, and also looking forward to just reconnecting and talking with some of you and supporting Madeline and her team. I think that Lisa did a great overview of who Transform Health is, but I will share that my background is pretty extensive in outreach and enrollment in the Medicare and Medicaid space. So I'm always happy to discuss either topic, as well as ACA and exchange marketplace coverage. I also do dabble in the short-term plan discussion when I need to warn people away from them. So on that front, I will just add that I think when Sarah, our policy analyst, talks, I do think we want to give a nod to 2 federal funding bills just to round out what Lisa just said, so everyone's in the loop. But how am I, what am I? I'm feeling, thinking, and doing. So I am feeling eager to get started. I am doing something with purpose today. I've brought with me a list of stuff that I want to ask y'all about, and I am going to take away my to-do list. So that is the whole of me right now. Sarah, why don't you introduce yourself?
Yeah, absolutely. So good afternoon, everyone. It's really good to be here with you. Like Heather and Lisa mentioned, I'm part of Transform Health. My name is Sarah Gleisine. I'm the policy analyst there. And the bills that Heather was mentioning, which I think are an important nod and also something that I'm thinking about as part of this icebreaker, and also just sort of in conjunction with the Biden administration priorities going forward, as we talked about outreach and enrollment being something that they're very much going to be focusing on. Those 2 acts are called the Enroll Act. They're the same name, but a bill that was in the House that is no longer happening, but there is one in the Senate that's called the Enroll Act, and that would restore about $100 million worth of funding to navigators. So while it did not receive a lot of attention under the current administration, it does look likely that it will receive attention and probably support in the Biden administration going forward. So how do I feel? I'm feeling optimistic, like I feel like a lot of people are here. And I also have some questions, and I'm really looking forward to the activities that we have planned with you all today. So I'm excited to get started.
Thank you. And so I'm also very happy to introduce you all to Jocelyn. I'm actually going to ask Kaying if there's anything you'd like to add as we introduce Jocelyn from the California Department of Healthcare Services and our partnership with DHDS to do this project.
Yeah, absolutely. Thanks, Madeline. And I am just delighted that Jocelyn is able to join us today. As you can see here on the slide, she is with the California Department of Healthcare Services. She's an analyst. So she is one of a number of analysts who is helping us appropriately roll out the Medi-Cal Health Navigator Program. And I have to say, you all, that we are so lucky to have Jocelyn as our point person at the Department of Healthcare Services for this critically important health program. I think you all, like us, may have been following the state's budget. There was a point when the project was on a fast track to be launched, and then it got it got put on a holding to determine whether or not it was going to remain in the budget, and then it came back in full swing. And we, that kind of stop and go was really hard to reach out to all of you for us to be able to launch this critically important portfolio. But thank goodness we had Jocelyn and her incredible team and colleagues who were very patient and really served as champions for really pushing the message about just how valuable this Medi-Cal Health Navigator program is. And so, Jocelyn, we are just thankful to have you as a partner in this work. I know that while the center is working directly with 4 counties, Calaveras, Amador, Lassen and Solano, we are not alone. And we're joined by many, many other partners like all of you today who are trying to do their part in different corners of the state to really make sure that individuals who really need to be able to have access to healthcare coverage and services in these times have it. And so with that, as just a brief introduction, Jocelyn, I'll turn it over to you and invite you to say a few remarks to our colleagues as part of the kickoff today.
Hi, good afternoon, everyone. Kayin, thank you so much for that introduction, and Madeline, thank you for inviting me here today at your kickoff meeting. So, like, I know this is your kickoff meeting, but I know, as Kayin just mentioned, there's been a huge effort on the state side really to get this project off the ground, and it has not been an easy year, as Kayin mentioned, with the public health emergency, the shutdown, and also changes in state guidance around retention. It really, threw some curveballs at us. So for me to be here at this kickoff meeting is also very exciting to see this materializing today for you all and the counties that everyone is serving here. Yeah, so I guess just to share some background about our team at the state, it's a very new effort at the state. I'm brand new to the Department of Healthcare Services. Well, I can't say brand new. I was hired on for this effort here, so I joined in January, to work on this project. But before me, once upon a time, we had 1 person working on this project, and then 2, and now we're up to a team of 6 at the state. So my role there is to oversee Sierra Health's contract or agreement with us, to be there to answer any questions about this project. It's a very brand new project for us. So we're also taking a partnership approach to learn from both, the counties that we're working with and the CBOs that we're working with, because, just as we have faced challenges with our funding, we know that the folks on the ground actually providing these services have also, faced a lot of challenges, not only with the public health emergency, but fires and, everything else thrown our way this year. So yeah, again, thank you for inviting me here today. Just really happy to hear, what's going on and put some faces to the names in the counties. So yeah, on the state side, this project came about really, from the advocate community and the folks that been advocating for Health for All and this funding. So the state allocated about $60 million, a little less than that, for health navigators. And something new that the state is doing with this funding is that it opened it up to community-based organizations. And that was a suggestion that came from the advocate community. And, as you all know, it is the community-based organizations are the partners that are in the community, that come from the community, that really know how to serve. So I think that was something that the advocate community put on the state's radar, and something that we're trying to implement with this project. So it's been, a little slow to take off, but we're also very eager to hear from you all and learn about trends and challenges that you all are seeing on the ground. It's our task here on the state side to administer the funding, but it's really, you all that are kind of designing how you're gonna outreach to folks. So we're really here to learn from you as well. So I just wanted to put that out there. I think even the way how this project first started to how we're thinking about it now has also evolved. At the onset of this project, And if you haven't taken a look at the DHCS website for this project, you know, there's a little bit more information about the background, but, you know, we thought, you know, a big outreach project with focus on different data points. But given the public health emergency and everything that's going on, it's evolving to really focus on enrollment and retention because of the increasing folks without health insurance, as well as, you know, some shift in state guidance around retention. And something that has really been a flag for state leadership overall is just, you know, the decline in enrollments. So that's something, you know, it's a big puzzle that the state is trying to figure out. So we're here to kind of try and solve this together. So we have monthly meetings with our partners to share and learn information from you all. So, you know, now that you all are on board, if you ever have any information or anything that you would like to share and funnel up, you know, please feel free to do so through Madeline. Let's see. I think, I guess some general things that I can say about our requirements for Sierra Health, I guess it's also helpful for you all to hear as partners is, you know, we're really interested in the data around this project. I think it's also interesting to hear the different strategies that it takes to reach folks in different counties, because we know it's different. I know some of you all have some of the northern counties, right, where the strategies might be different than, you know, the Bay Area that's saturated with maybe a little bit more resources. So I think we're very interested in hearing that, especially, you know, what strategies are working not only in different regions, but during this time of emergency. So we are looking to collect different data points, and all that information is on our website. So if y'all don't have that, you know, I welcome you all to visit that. Our website also contains different bulletins that we've sent out and shared with Sierra Health and all the other partners that are participating, you know, just general guidance about the project and different expectations. You know, it might not be super relevant to your specific partnership with Sierra Health, but I think it might be helpful to kind of see, you know, some of this information that we have up there for everyone. Let's see, talking a little bit more about the project itself. The project has a time cap. It's set to end right now through December 2021. There are talks of extending it for a few more months, but that was pretty much the way the project and the funding was written. You know, but we didn't expect those challenges, so we'll see how it evolves. Let's see, kind of thinking to see if there's any other information I would like to share with you all, just in general.
And Jocelyn, since we have you here, if anybody has any questions for Jocelyn, I think you could put them into the chat, and Gina can help us filter them. I don't know if there's any immediate questions for DHCS, or we can also, you can send those to me and we can work with Jocelyn offline.
Yeah, for sure. So if you have any questions, please feel free to ask. I think, you know, that's kind of the extent of what I want to share today, just some general information. I'm not sure, Madeline, if you wanted me to speak to something else, but, you know, just a little bit about our team at the state, as well as about, you know, this project and how it came about.
No, I think that's great. Thank you so much for being here. It's really helpful to hear about the priorities at the state level, and to just know that you're here for us, Jocelyn. So we really appreciate the partnership with DHCS and the continual learning opportunities we have with you all as we continue down to our own learning pathways. So with that, so thank you again, Jocelyn.
I had a question, Madeline, if I may.
Oh yeah, sure, yeah. Alba.
Jocelyn, nice to meet you, and thank you again for everything that you've been doing. I know it's been months in the coming, and absolutely some opportunities and challenges that we've been facing. as a state and as a nation. Just wondering, how do you also see your role in terms of support with working with our local, health and human services in county? In what level can we use you as a resource, or what support is also available there?
Yeah, for sure. So the guidance that we give usually is we really encourage these partnerships to surge at the local level. So we encourage, you all to reach out to your local human health and human services agency. But then we have this thing, right? If you're having issues reaching them, you've tried emails, and that's when we can kind of step in and, you can ask Sierra Health and funnel it that way, like, hey, we need help reaching this specific county, and we can kind of step in and see if we can find a contact for you. So I guess to sum up the guidance, we encourage, those partnerships to kind of surge on their own, but if you're having those issues, we can kind of step in.
Yeah, I guess as there's been no issues, but as issues surge, I suppose that's a good thing to know. So thank you, I appreciate that.
For sure.
So maybe I'm asking a question a little prematurely here, since I haven't spoken to either of the, well, I have, but I didn't get specifics on from either county that will be supporting. Is there a common statewide web portal interface that we enroll people through, or is it county level, or do you know?
Let's pause that question, Joe, and I'm hoping that we can talk about that a little bit further down the line in the meeting. Okay. And actually, in the effort of time, because I know Jocelyn has limited time as well, if you have any other additional questions for Jocelyn, feel free to send them to me, and we will do some follow-up and answers back to everybody. So feel free to put them into the chat or email me directly, and we'll make sure to get everyone answers. Right now, I do want to, because this is our kickoff meeting, this is our first chance to all be together, I am hoping that I want to take a few minutes, but not a lot of time, to just kind of walk through our scope of work. The purpose of this is really to just remind ourselves of our scope of work that we're working towards, and kind of ground us in that work. And then, but you've all received this previously within your agreements, so we won't spend too much time, but a quick overview. A reminder that for this project, we will be doing outreach, enrollment, and also redetermination. And part of that is also maintaining accurate records of outreach, enrollment, and retention data. We do have some reporting. We're going to talk a little bit more about that next. But we have monthly data reports as well. And we also have a progress report that's due to the center about 6 months in. And then we'll have a final report once we wrap up and your time period for the grant is come to a close. Again, we will have the expectation to participate in learning activities. That includes receiving technical assistance from experts and peers and sharing best practices. And so kind of what we're doing today, we'll participate in meetings. We will meet with you, or I will meet with you individually as organizations, and we will also have the convenings where we come together, and we'll and other learning opportunities as they come up. Again, that progress report that I mentioned, and this will also include a financial report, so we can get a sense of where we're at. And then Gina, can you go to the next slide? Again, oops, one more back, there you go. And the monthly data report. And then just to be open as needed to partner with any communications or public affairs requests as they come up. So every now and then we receive those requests and we reach out to our community partners with our communications team and would like to work together on that with you all. So that is kind of the overview of the scope of work. I just wanted to make sure that we all understood that and we're clear. Joe, it looks like you unmuted yourself.
I did. And I'll apologize in advance for the many questions that I may be asking. But this is a question that I asked early on when I got the statement of work, and I don't have an understanding of the answer yet. And so if you could just back up one page, and this is probably something that Lori and I can work out, but I'm just wondering what Sierra Health's perspective is on this particular requirement. And it's number 3. And the only difficulty I'm having with it is that Nexus and ADCA are sharing a portion of the 2 counties. And we can't, and I'm sorry, I'm a math major, I'm not, I have difficulty understanding how 2 parties in the same county with 100% of the potential redetermination clients, how both of us, Nexus and ADCA, can get 66% of them. So do we need to work together to say, well, maybe Nexus takes on 66%, attempts to reach at least 66% of the beneficiaries who are due for redetermination in Amador, and we do 66% in Calaveras, but we can't both do 66% without doubling 1/3 of the population, if that makes sense. So
Yes,
I just want to make sure that we're in alignment with expectations here.
Yeah, no, that's a really good question, Joe. And you and Nexus are in this beautiful partnership in that the both of you are working on 2 counties, Calaveras and Amador. And I think this is where, to Madeline's point about following the kickoff here, she's going to loop back and have individual conversation with each one of you. And this is where we're going to, Transform Health is going to be joining us when we have these conversations with you, because these are the goals and objectives that we submit to DHCS, right? So we do need to honor them. How it shows up in your respective work plan, we'll work with you on what that is. And I would say part of this is understanding from your universe of potentials that it would be 66% of your universe, however you define that. And we'll work with you in creating, better definition of what that universe would be, and wanting to make sure, though, that there aren't any duplicative effort from what you're going to be doing and Nexus is doing. So you raised up a really good point, and this is both the beauty and the challenge of having multiple partners who are working in similar county. I don't believe we are the first to have that challenge. I'm sure that there are, our partners at CHI and our partners in United Ways and others who are deeply in this space have encountered similarly this challenge as well. But I like to think that with the both of you working in both of these counties, it means that we'll be able to make some significant, dent in terms of being able to reach out to individuals and families who would be eligible for Medi-Cal. And so let's work. Let's make sure that we have that specific question discussed when we come around and do our one-on-one with you. It is very much on our agenda for the individual conversation.
Okay, and maybe if you don't mind me just adding that either myself or Patrick can get together with you, Lori, or whoever you designate, and we can figure out how we cover the 66%, whether it's 33% each or 66% by one and none by the other, whatever. I'm sure we can work it out.
Yep, absolutely, Joe.
Okay, thank you.
Good.
Thank you both for that spirit of collaboration. I like that. That's what we're hoping to achieve here today. So Is there any other questions about the scope of work while we're still here on these slides? And otherwise, I think, Gina, we can move forward. And Sarah, do you want to talk quickly about the numbers?
Sure, absolutely. So these are the aggregate target goals to get people into the Medi-Cal program for Amador, Calaveras, Lassen, and Solano, the 4 counties. So as you can see here, combined, the partners, you guys, have a target of about 46,000 residents in these 4 counties. And then you'll see here as well that to actually enroll those people in the 4 counties, that's a target of about 8,000 people. So these are the numbers that you all submitted as well. So I think that these are probably pretty familiar. And then, sorry, yeah, you can go to the next slide. My apologies. Thank you. And then this slide is really just to provide some additional sort of framing and grounding for all of us as we continue with the presentation, just about sort of the general picture of health insurance coverage in the state. So as you can see here, in California, there's about 93% of residents are insured. And you can see that about 7%, which equates to about 3.5 million people in the state, are still uninsured at this time. And I think one figure that is important to note about that 7% who remain uninsured is about 20% of those people actually qualify for Medi-Cal but are not currently enrolled. So I just wanted to give that quick sort of grounding on the numbers, and we can continue onwards.
Thank you. I want to let Noemi talk briefly about the monthly data reporting and the efforts from our evaluation department.
Thank you, Madeline. As I mentioned previously, we contracted with Harvey Evaluation to conduct a needs assessment of the ability of each of the funded partners to identify, again, the ability to track and report enrollment and retention data, among other required data points that the HCS require us, and to identify the technical assistance needs so that we can better support you. Our consultant is going to then work on developing a data collection and reporting plan to, again, make sure that we are able to report that data to the HCS effectively. Right now, we are working on providing more guidance on the monthly data reporting, since we also need to report quarterly reports to the HCS. And so we want to streamline the monthly report that we require you to complete so that it's efficient and effective in a way, and we only ask for data that we actually need you to report. But yeah, we'll provide more guidance very soon.
Thank you, Noemi. We'll send out those that guidance and and instructions and in detail soon, and we'll provide some technical assistance for those who need that. And then Sarah or Heather, were you going to speak to asking about training needs?
Yeah, actually, Madeline, we have a short memo that we're going to provide for you and the partners too on this, so it might help Joe kind of walk you through the steps. But Sarah, why don't you just briefly cover that, and then we can also pick on some folks here who I bet have a lot of expertise in how to cut through the noise and become certified in this space, as it were. But Sarah, why don't you go ahead and then I'll circle back.
Yeah, absolutely. No, I think that's the perfect introduction. So the memo is very brief, but really sort of talks about sort of the two-pronged process that is required to become registered with Covered California with that system. So the first thing, and you'll see it up here, it's the first bullet, is to become a certified entity. And then a certified entity can have certified enrollment counselors. So the process of becoming a certified entity really requires someone from the organization to basically be the entity representative. It's just someone who fills out the account information. They take a training, a leadership training, and then they're able to log a roster of enrollment counselors, which is most likely your staff or whoever's going to be providing sort of those on the ground enrollments. And then those people who are doing so, once they're added to that roster, they themselves are able to go into that portal, the Covered California portal, and take the training to become certified themselves. So we, like Heather mentioned, are going to be distributing that memo to the center as well as all of you all, the partners. So stay tuned for that. But I think that's probably a pretty good sort of brief overview of the training needs there. And I know that we're going to be delving into a little bit of those. Like Heather said, best practices for cutting through the noise. So yeah.
Yeah, Lisa, I'll pick on you in 1 second, but I just want to respond to something that Joe asked about earlier. The place for everyone on this call is Covered California. All right, Lisa.
I was exactly going to say something similar. And Joe, you probably are wondering, why are we redirecting you to Covered California? Because Covered California is the exchange and not the Medi-Cal agency, right?
I am wondering that.
I figured that might be a question. So when the ACA passed, California was one of the first states to really stand up and implement the ACA fully. And one of the things that we did was we aligned the work of the exchange with Medi-Cal, as well as with our Healthy Kids program, which on the national level is called CHIP, the Children's Health Insurance Program. And so we as a state decided that we want one centralized place for training, for coordination. And the key reason why is because the population that's in Medi-Cal, many folks that are right on the edge of 133% of the federal poverty level, which is the maximum income level you can be, you know, fiscal things can change. So a lot of that population will shift into the Covered California population and back. And so we see this shifting and churning between these two programs. We also recommend that folks really, when you're thinking about how do you support and serve your community, knowing that, you know, some families that you run into maybe mixed household, or maybe they fall into that income bracket that's churning between Medi-Cal and Covered California. Engaging with Covered California means you can offer them a solution and highly subsidized coverage. And the federal government is currently talking about increasing those subsidies even more. So we as a state have centralized a lot of the training and a lot of the systems to sort of track applications through Covered California because it was an available funding stream, which is why it's really important if you don't have a system that you're engaging with. You know, the CalHERE system built through Covered California has a Medi-Cal portion that will allow you to and help you track cases. We also have another alternative at the county level, but that system continually evolves. And so this is one of the reasons why we are suggesting that you all take a look at Covered California. If you're not a covered entity, you might want to consider being one because it will expand what you can offer your clients. And they offer a lot of support and free training for both how to do Medi-Cal enrollments and coverage, as well as Covered California. So it also is another way to think about sustainability of this work post-grant.
Yeah, thank you. Also, I just want to mention for folks who are new to this, that it will take some time to get plugged into the system, but there are things you can do and learn and triage around outreach in the meantime, right? So I know there's some other folks on this call who have gone through this process, so I would like to open it up to see if anyone else would like to share any words of wisdom for those who are new to doing this. And if not, we can talk in greater detail in your one-on-one about the steps. No pressure.
This is Teresa. I can share. We actually got a grant from United Ways of California to do Covered California. And that was about a year ago. So we've been on that program and are accessing that portal already. We weren't getting paid for doing Medi-Cal applications at the time. We were just getting paid for doing Covered California, but now we are. So that made it real convenient to be able to be a part of this project, because we don't have to be an entity. United Ways of California is the entity, but we are all certified enrollment counselors through Covered California. So we're able to access the Medi-Cal application that way. I do want to say that it is a long, involved process, because you have to get not only certified through training, but you also have to get FBI and background checked through the process. So that takes time. So once you get the okay from your entity to move forward with getting your background checks done, you should do them as soon as you can, because it takes a while. So yeah, I'm glad we're one step ahead, but I do offer my empathy to all of you who have to start from fresh. So yeah, so good luck.
Thank you for that.
So that asks,
anyone else?
If I could just ask a question
Jeff.
of Teresa. So when you mentioned background checks, so I won't go back into my past life, but I worked 35 years in aerospace executive management and had to go get background checks and polygraphs every year. So is it that kind of background check, or is it every one of our employees goes through a DOD?
DOJ and yeah.
I'm sorry, yeah, DOJ and DMV.
Yes.
Is that
FBI and DOJ are the two background checks, and you go to a sheriff's department and they do your fingerprints and
okay
through. So it's not real invasive. It's
okay.
It's simple,
All
but
right.
it takes time. It takes time for them to get back to let you know it's passed. So
yeah, thank you, because some of the background checks that I had took a year.
yeah,
So
this won't take that long, but.
okay.
There's also plenty to do in the midst of all that. So I think in terms of just talking about work planning, which we're going to get into a little bit, I wouldn't worry too much, but yeah, getting plugged in as soon as possible is going to be a priority. Does anyone else have anything to share on that front, just to follow up on Teresa's great wisdom? Okay. All right. Well, Madeline, I'm not sure where we're going next, so I'm turning this back over to you. Oh, that's me.
Yeah, I was gonna say, well, Heather,
here we are.
Yeah, we're actually going to talk a little bit about those action plans that you mentioned. So we have some space today to kind of work through some of this together, and Heather is going to lead us in a conversation around action plans, and really it's about working towards our goals, allowing for us to document our ideas, and really feed this collective learning and action. And so and the action plans are going to give us a chance to get organized together and to get organized on the organizational level. So I'm not going to talk too much more about it, because I know, Heather, you're going to do a much better job at it than I am. So I'm going to kick it over to you so we can start kind of talk through our action planning exercises.
Okay, well, all are welcome to chime in. That's why we wanted to have everyone on video, in case we see you falling asleep. And we just want to make sure that we're offering something of value and that's meaningful for you to take away from today, as well as all the other great information on this kickoff. So I realize some of you are in different places, so I encourage you to use the chat box as well, because we don't want to miss any insights that maybe we don't have time to discuss today, but please be generous and use the chat. Feel free to chat amongst yourselves as well in the chat box. But I just wanted to make sure we got the full immersion of us being together today. The other thing I wanted to do is a really quick, a couple of polls that we have teed up. So I'm not sure, Gina, if you have those ready. If not, I'll come back to you in a sec. But we wanted to check in with y'all and just have you fill out a couple of polls. All right, so I hope everyone can see the screen, but we're wondering if you could just fill out as many as possible here, and if we don't have them all captured here, that we can put some other communities in the chat. But are there partners you're already working with for outreach or inreach? And we just populated some examples that came from your scopes and also from the application. But if you could take a moment and fill out this poll, that would be great. I think you can check as many as possible. I also want to make sure that while you're doing that, that everyone is aware that when we meet in the one-on-ones, we're going to talk more about the intersectionality and the need for you to understand both county-based relationships that you need vis-a-vis DHCS and also covered California. So we will get into that more. But I think for today, we just wanted to make sure everyone was aware of what they needed to do next. All right, how are we doing on the poll? Is everyone done? All right, Gina, drum roll. Results are, I think it's good for everyone to know also just how you're maybe intersecting. And there was a question earlier around working in the same space. How are you going to collaborate? Okay, I'm not seeing the results of the poll. It could just be me, but I'm going to ask Gina to pull that up. Okay. Okay, it looks like a lot of you, wow, okay, health centers and hospitals. It's a big one. I wondered about COVID testing sites. We'll get into that in a minute. Okay, schools and colleges. Oh, Yvonne wasn't able to see the poll. So Gina, I don't know if you wanna troubleshoot that. We do have another poll that I wanted to ask about as well. All right, so this is helpful for us to see. So a lot of you are already plugged into schools, which is great. The other very popular outlet might be faith-based because of the Zoom aspect. So we'll get into that in a minute. We do have another poll, which is the target populations that you're focused on in particular. So I'm wondering, Gina, can we pull that one up? Because we wanted to get, I know you filled this out in your application or your RFP, but we wanted to also have everyone else know kind of what the scope covers in terms of the landscape of who you're serving. So if you could just check off as many of these that you plan on targeting or working with or already are serving and you're going to be doing in reach around, that would be great. And then as soon as everyone's completed it, let's pull it up. All right, how are we doing? Everyone checked all the boxes? We just do this to make sure you're all awake.
We have 8 out of 15 who's responded.
All right, well, I think
And
we
not
can
everyone
pull it.
will
I think the
respond
8
because, yeah, because we're not all, I'm not
8
responding.
is quorum, I think. So let's do it. All right, what are these results? Okay, let's see. Wow, this is a great spread, actually. So we have, I'm curious to know about the mental health and substance use folks and just kind of your experiences with that, and being able to report on that, I think will be helpful for everybody. I see the uninsured children, and this is a really great spread, honestly. Madeline, I don't know if you have any questions around.
Oh, and you know,
Kaying.
the Zoom doesn't allow us to list, you know, every possibility. So if there's other populations, you know, you can put them in the chat box or let us know as well.
Yeah, there might be other groups you also end up doing outreach to and or serving in the midst of creating the work that you're doing once word gets out. All right, so I think we've got a really good spread. And are there any reactions to any of this?
I guess I just wanted to explain, my answers included, we see people, we have a number of customers that come in who have substance abuse issues or disabilities or mental health issues, challenges. We don't target them specifically, but the people that we deal with who are tremendously low income, many of them homeless or at least housing insecure, are in that population. So we don't target them specifically. They just happen to be a part of that population. So.
No, that's a really good point. And a lot of people don't fit these boxes. We all have many hats in our lives that we have to wear. So I think that it's going to be important to figure out sort of where, what, whom, how much, and what you're scaling as well. Okay, well, that was our exciting poll, guys. Let's move on. All right, so now we're going to talk about the usual stuff, which many of you, we have someone who wrote in working with wildfire survivors. Yes, that is, I guess Teresa wrote that. Yes, and climate migration is another issue. People also that you start helping and then they move away or they leave. There's going to be a lot of issues around climate change, and that's also a priority in the Biden administration and the incoming administration. So I think there's going to be a lot of layering that goes on over the course of the next year as well. So that is something I think maybe we're going to want to have some guest speakers come talk about, or maybe plug you into some other groups that really focus on climate and health. Climate health and public health groups I think is really important. And I see Indigenous population mentioned in the school districts as well. This is great. Okay, so we're going to get into some ideas in 2 seconds. Let me just get through the pro forma stuff that we need to make sure we're all on the same page about. So the first thing is, I know all of you in your lives, if you've had a job before, have heard about SMART goals. The reason why I am going over this information today is really, it's modeling for you to take it back. So in a lot of ways, this is stuff you can use with the staff you're either hiring, the people you're bringing on, or the volunteers you're enlisting, or the partnerships that you have. So I would encourage you, maybe if this isn't necessarily something for you, that the material, which is why we're recording it, is useful for the partners you're going to be sitting down to plan with. So I just want to make that mention that we're going over these materials in a lot of ways so you can take them and run with them and use them in your own way. So with SMART goals, we've all heard of this, right? Raise your hand if you've heard of SMART goals, all right? So if anyone has not heard of SMART goals, I'm happy to do an offline one-on-one with you. But in sum, SMART goals need to be SMART: specific, measurable, attainable, relevant, and time-bound. What does all that mean? SMART goes by many acronyms. You might have seen other words like simple, significant, sensible instead of specific. Or you may have seen meaningful or motivating if you're working with groups who have a lot of feelings and we need to organize around those feelings, instead of measurable. Achievable is another way to say attainable. Relevant is another way to say, is this reasonable? Is this realistic? Is this goal realistic? Am I actually going to work with reentry populations when there's no jail in my county? So it's a lot of this stuff you've probably already thought through, but also time bound. It needs to have an ending. Everything needs to have a deadline. If it doesn't have a deadline, we do things in perpetuity. So you want to have deadlines so that you can feel successful in meeting these goals. So a couple of things I like to ask that I think might help organize partners is, if you want to accomplish something, why? What's important about that goal? And then who needs to be involved for you to accomplish it? So that's the specific. Why should you do it? Who needs to be involved? To what extent and how? And then you need to talk about the resources that are involved. So that's all about the specificity of a SMART goal in this case. When you're doing something that needs to be measured, obviously you have reports. We've all discussed those. You've heard from everyone on this call about the reporting, and we can spend some time on that in the one-on-ones. But I would say also, when you're thinking about measuring the success of what you're doing, you need to be able to quantify how much, how many, and how will I know when it's done? How will I know I accomplished my goal? I think we all have that implied as they got enrolled. But I would also ask that you track where they are in the process, because oftentimes it's not a one and done. When you're talking about outreach and enrollment, you're talking about really multiple touches to get someone over the finish line. And those touches are meaningful. Each one of them is grounding you further and further as their trusted resource, their trusted messenger. So it's really important that if they're tired, you listen to that and you don't push them through, or you figure out a way to triage the enrollment so that you're not piling on and doing a HEAP application, an SSI application, a food application, and a health enrollment. That may not be feasible for the person. So how can you work with them to continue them on this path or this arc to make sure they actually get enrolled? And we'll talk about that in a little bit. The other thing is, it needs to be relevant. Does this seem worthwhile? Is this worth your time? Of course it is. You're going to get people coverage, and that's always, always valuable. However, in this time that we're living in, a global pandemic, which no one's lived through in 100 years, so there's no one else to ask unless you know centurions, we are facing a really difficult time in terms of talking to people about the value of coverage. It is not the same as years past. People are deciding between food, where they're going to live, how they're going to live. Maybe signing up for health insurance is something they feel is too abstract and too far away. How do you make them understand that it can actually maybe increase their income if they qualify for Medi-Cal, and it can help to plug them into so many other benefits? So I think making that case for economic stability for that person and that family is really important as well. And then finally, just deadlines, deadlines, deadlines. What are your deadlines? How many people are you trying to reach in the time frame that we have this project up and running for? And then also within that, what if you're not meeting your goals? How do you recalibrate your goals to make sure that you can do what is realistic and meet the community where they are? And how do you bring folks along so that they understand why you're doing what you're doing? So with that, I'm going to forward us to the next slide, please. And thank you, Gina. Tech is very important on webinars that we're all on so many of these days. So I would encourage you to take this slide back and play with this one with your staff. Really, I do this training and it's a whole day. So I'm cramming 30 minutes of information in so that you can take some tools and tricks and tips away with you. But essentially, when we talk about SMART goals, I like to also make certain ambitious goals smarter, meaning, let's take, for example, I'm going to engage 2 to 3 faith leaders to receive referrals during what was open enrollment 3, which now we're in open enrollment 8. Let's take that as an example. How can we make that goal smarter? Meaning, how is it more relevant? How are we going to meet the deadline? What is it that it needs in order to actually be a SMART goal? I don't know if anyone wants to take that one, but I'd love to hear some real world examples. If you have worked with faith-based leaders, has anybody done that in any of your counties? Hi, Teresa, yes, I see.
Now, we,
feel free to unmute as well. Go ahead.
Can you hear me?
Yeah.
Yes, okay. So yeah, there is an organization that works with transitional housing, and they're a faith-based organization, and their director is going to work with us to refer people that are in need of Medi-Cal. So that is one of the
great
organizations, but we also have, Camille is part of a very, very large faith-based organization here in the Reading area, and she oftentimes brings posters to their community and, you know, board and that kind of thing. And anytime we have any programs, because we are managing 8 different programs up here in the North State, and so we're always looking to do outreach. But yeah, we've actually touched with a couple of faith, but I think that we need to work a little harder on that. So any ideas on how that looks and what's the best approach would be very helpful.
Yeah, I think you're hitting the best approach. The people who go to the churches, connecting with whatever religious group it is, tends to work better with a member on the inside. But there's a lot of, I think, groups that are eager for this information, and they may not even know it. So, but let me ask you this, does your poster sort of resonate with folks, or have you done any testing around how many people saw the poster in terms of just the approach you're taking? Is it working?
Camille can probably speak to that because she's the one who's been doing the outreach for those organizations. I think as we just started to add 3 more counties to this Medi-Cal project, we don't know what the metrics are, will be. It's just it's in its baby phase right now, but they have agreed to do the referrals. It's just that, of course, we haven't gotten any just yet because it's too new in the project. But as far as Camille is concerned, I know that she has received people calling because of her poster, but we keep track of all of our outreach.
Great.
So
Camille, you've been picked on. Do you want to say anything in your in your honor?
Sure. Well, outreach is my thing. I love networking. Really, I do. It's like my niche. I love reaching out to organizations in our county and just kind of telling them about our program and what United Way does. So I did an outreach with my local church I go to. I did an outreach on a Sunday to feed the homeless, and the gentleman running it says, "Hey, he heard where I work at, sorry, and he asked me, hey, could you send me a brochure or information about it, what you do and stuff, because I want to pass it on to our board." Well, that's just like a nice open door. So, but I've been a little bit busy on the other networking with other counties. So I do need to follow up with him. That's the one thing, is like when you start getting going to let the word out about Medi-Cal, Cover California, and networking with other counties. I think the biggest thing is, the hardest thing can be is following up, remembering, hey, I need to talk to them again. It's been a couple weeks with everything else you're doing in your position. So yeah, so then I kind of fall short with right now, because I'm kind of trying to go into Siskiyou County and getting the word out in that county, because they lack information and support, especially support. So so that's something that's important to do when you do networking. The important thing is follow up and seeing how it's going, if it's who it's reaching, and if anybody's interested. So feedback is important. So
that is so true about the follow-up. I think there's a lot of nodding heads on that one. And it is hard, right? It's hard to balance making sure you're keeping track of who you've met and the metrics around that. So I think in terms of when you said outreaching to new groups, I believe you alluded to that. Do you have any advice for folks who've not ever done that before? Are there any messages that you kind of use in your back pocket that might be helpful for folks who are new to this to think about? Also, I love the quote, outreach is my thing. Can we put that on a t-shirt for this group?
And in so many words, right?
Yeah.
Sure, I'd love to expound on that. This is what I do. For Lassen County, you call the Head Start programs, you reach the low-income families and who they're talking to and stuff, and then you send your information to them and your flyers and stuff, or you print out flyers for them if they can afford it. You kind of network that way, and then like I said, follow-up is important. And then you call the chambers. Chambers is a big thing. Chambers reach all businesses, all organizations across the board. So the chamber is like where a lot of people go to. Some are shut down, but some are still open. So you have to be careful and when you call and stuff, because some are just shut down because of COVID. But the chambers is another big thing. And advertisement's huge. Even going like you can still go door to door. You can still knock on doors with your mask on. Well, some you can still. I think, maybe I'm wrong. Anyway, so just reaching across the border and trying to talk to other people that, especially like the counties that are rural area, because in Northern Cal, there's a lot of rural areas, and those areas are not reached as much or forgotten. And so when they hear that you have these programs and that you support low-income families, they're just thrilled and they want to know more about it. So, and yeah, local newspapers too is a good one. Radio, we have the TV radio ads and stuff. We do that. We signed up for that grant. Actually, that grant was free for us. I just stumbled across it, called the radio station. They said, hey, we got a grant, for $3,000. You can, advertise on there. So that's year-round advertisement for United Way. And there's others. So
yeah.
Anyway.
That's awesome. And in the chat box, I see church bulletins. That's a good one. Local newspapers for sure. Lisa loves the quote, find your local power broker. It is true. Who's the person that really runs the town? There's always the one that is in charge, but who's really in charge? Find that person, right? Can I get an amen? So yeah, I think that is perfect. That's a really great list, actually. Head Start for sure. And then I think you alluded to radio. So radio reaches communities that, and it has for years, reaches communities of all types, frankly. I mean, if you think about, you probably have a podcast or something that you listen to. Radio reaches all types of populations still. And one way, if you don't have money for advertising, one way to get on the radio is to offer yourself up to do an interview. If you do want to do that, let me know. I mean, I'm happy to work with Madeline. We've done messaging around story banking and other types of, you know, how you stick to your message when you're on air as opposed to getting swept up in their questions, I think is a technique. But once you learn it, man, you've got the radio back in your back pocket and they call you all the time. I see YouTube, that's a really good one, doing a YouTube video or having someone else plug you on their YouTube video. So for example, now we know there's a lot of people who can make money on YouTube. You don't have to make your own video. You can write a little script for them and they read it and tee it up in their video. Facebook Live events is another one. Town halls with local officials as well, because they have the built-in audience, can be a way. Or your community, if you have a Facebook page, do a Facebook Live and get everyone you know to share it at least one time. You'd be surprised how much free stuff you can do to get the word out. Food banks, pantries, for sure, barbershops and salons, neighborhood associations. I love that you brought up the chambers as well. That's a really big one, I think. And some of you are doing benefits outreach or benefits enrollment as it is. So I'm also wondering how many of you are going to be doing sort of an in-reach approach where we already serve this person in this way, but we know we can help them with a Medi-Cal application. So what do we need to do to get them there? I think is really important. What I would also suggest is thinking about, when you create your work plans for this, thinking about the layer of remote and virtual reality here, because these are amazing ideas. And now you have to layer on the fact that you might have to do a lot of it remotely. And the thing about doing some of this stuff remotely is that it's going to require more touches, not less. And it might be it may take you longer to have that relationship. Whereas in the past, you just would show up with a stack of things and you would talk to people who were there and they would introduce you to one person and the next person. Everybody is now in this very didactic Zoom-based world. So you want to think about taking advantage of the fact that there are virtual platforms that exist and you can quickly get the word out through those. So we can brainstorm some of those as well. I'm going to move us on to the next slide because I want to get into the brainstorm. So does anybody have questions about SMART goals? Anything that we want to talk about there? I figured most people have seen it, but if you have new staff who have not, it's a really good framework to plug people into thinking about their approach. Because let me tell you, and Vita tax prep sites, yes, that's also very important. Once you start going with outreach, and I think, Camille, you were alluding to this, people start to know your name. The phone doesn't stop ringing. People don't stop coming to you, right? I'm sure I can get testament to that. So what's important is that when you've got new staff who are doing this work, they need a system by which to organize their thoughts, because you can get swept up in outreach very quickly and lose time and sort of lose focus and lose touch with folks. So you want to make sure that they have a framework to work within. So let's go skip to the slide that, well, actually, I'm going to change things up a little bit. Sorry, Gina, I don't mean to confuse, but I want to get into the brainstorm. So I'm going to ask Sarah, who is on my end and ready to type in front of strangers, which is always a skill. I'd like Gina to share your screen with her, if that's okay. And then we're going to get into it in the essence of time. So we have a little activity planned for those of you who are my overthinkers. I think I can pick out a couple of you, but how many of you in this group are my overthinkers? Meaning you do what Kamala Harris said, you wake up in the middle of the night at 3 a.m. and you make a list. I'm one. All right, so we're gonna have Sarah be my person who types all this out for me. So I wanna move through this quick. But I want to come up with you all today, and this will help inform what we do in the one-on-ones with everyone. What are all of the challenges that you could possibly think of shout them out, put them in the chat. We're going to capture as many of these barriers as we can. Why am I doing this? Number one, everyone always gravitates to the problems. So we want to call those out and get them off of our plate. So let's make a list of what those are right now. What are the problems and challenges? COVID, yes. That is an easy one and a given. What else? Other challenges. Distance to the target area. Weather. Feel free to unmute and just shout these out as well. Language barriers, yep.
Transportation.
Big one. What else?
Looks like Joe said financial limits.
Financial limits. Say more about that, just so we can word it carefully.
Sure. So it's just budget limitations. There's only so much we can do on the amount of money that we have.
Gotcha. Yep, that's always an issue.
Yeah, can't blitz the radio for 24/7 for the next 15 months.
Yeah. Fear. Yes. Especially coming out of the political climate that we're in.
We have local HHSA support.
Okay. I'm going to add another one, health insurance literacy. What else? There's lots of problems. Let's get them out there. Just call it what it is. Website problems, internet connection issues.
Access to technology.
That's a big one. Lisa, hard to reach people are hard to reach for a reason. I think what I want on my t-shirt, and this will be Madeline, our next icebreaker, is what would go on your t-shirt. Mine would be hard to reach. That's me, because I'm an introvert. So what are some others? What about partners? Any problems with partners? Is everybody bought in? How many of you have talked to partners that you're hoping to get referrals from and they've said, yes, I will send them all your way? Camille's laughing.
I would say also like time limits, like, you know, to do all that follow up, you need lots of time.
It's true.
I had an outreach worker who said he worked 25/8.
I like that. I feel like that. Technology literacy, yes. What about setting up their account with the website or understanding, you know, what paperwork they need to give you? What other problems do we need to think about here?
I have a question. So
yes,
one of the things that the Department of Healthcare Services is requiring is data validation. This is what we discovered, and you have to go through the Medi-Cal department at the county level to get that validation. They didn't provide much guidance on how to do that, so Camille called Cover California and the Medi-Cal representatives, and she was able to get a account representative form. Not all the counties use the same form, but it is a way to get the county to validate that data. And that's done monthly, I believe. So That was
data
a
validation.
challenge.
Yeah.
That was a big challenge.
So, yeah, I think, how long did that take you to get that established, would you say?
I think Camille was able to make the contacts probably within about 2 or 3 days. We were able to figure out what forms that they were accepting. And we made I made direct calls to some of the directors of health and social services. And from there, she went with it and just started calling to verify. And she did go through the Medi-Cal representative through Cover California's portal to get that approved. But that will be a challenge too, is depending on how much of a relationship you have with your local county Medi-Cal department.
Well, and one step below that is what's the data that we're supposed to be gathering that they're supposed to be validating?
That the client that you enrolled actually received Medi-Cal, because what we're doing is we're enrolling these clients, and then that application actually goes to Health and Social Services to be processed. So we really don't know whether they got approved or not between the time we actually file that application and the county receives it. And it could take them up to 30 days past that time to approve that person. So
I want to note that Elba put in the chat as well, and this is in line with that, just the time that it takes for a county to process a Medi-Cal application in addition to the timing point being made. Okay, so yeah, sorry, Camille, go ahead.
I'm sorry. As far as the insurance goes, I think one of the biggest challenges that I've faced since doing Covered California / Medi-Cal is dealing with Covered California. When you're in the middle of application and all of a sudden you get the glitch, it's like, oh shoot, and you've been on the phone for over 20 minutes with the client, you gotta call them back because there's a glitch with the system. I had that happen a couple times, and then they hang up on you. So had that happen too. But you know, that's all work in progress, but that's the biggest thing, is just working with the computer system and not have any glitches and just everything just goes smoothly, you know, when you're doing an application.
Yeah, technical glitches is a big thing right now. That is a real problem. Do folks have any best practices they want to share in that way, sort of in that same vein? Get their phone number first before you start anything. Just anything you want to highlight there, we're welcome to capture that, I think, for the group. I also want to note another problem, public charge and immigration. Heck yes, I think that kind of coincides with the fear point made earlier as well. Okay.
I wanted to address Joe's point about sort of the relation and the points people were making about relationships, particularly with the county.
With the counties, yeah.
You know, in California, county eligibility workers determine Medi-Cal eligibility. It is done on a per county basis. And what that means is, you know, to affirm Medi-Cal enrollment, you'll want to work with your county. It usually is the Social Services Eligibility Division that does that work, and having that relationship will go a long way. It is sort of a little weird because it's the Social Services Eligibility Division that handles the eligibility piece, but the Department of Health Services within counties tend to do the healthcare programming, and so that is split apart, which is why you want relationships with both sides of the house. Some counties, there are county SAWS eligibility systems. I think we took a look of the 4 counties, all but Solano are on the C4 system. I don't know if you guys have access to that system, but if you do, that is another way to look at and affirm Medi-Cal enrollment. And some counties and some health plans have also gone down the path of there's a service that you can pay to get access to that data. So there's a couple ways to do this. We should definitely talk further about this in the one-on-ones. And for Napa, CHI in Solano, that's the only county that's not on the C4 system. They're on the CalWIN system. That's actually a benefit because, you know, in talking to advocates and enrollers statewide, there's a preference for the CalWIN system because it's a little more user-friendly. But those systems are other ways to be able to get some of that Medi-Cal enrollment data faster.
Thank you, Lisa, for saying that. I'm just chatting some stuff in the chat box for people to grab. If you can just click these and have them open in your windows and maybe bookmark them, we can talk more about what is involved in those other portals. So I want to get back because it is quarter till and we have to wrap up really quick. So what I'd like to do at this point, since we've captured a lot of problems, and these are all very relevant, I like everyone to go in with things eyes wide open. So now that you have a sense of sort of what some of the issues are, and each of you has met each other and know that you've got some real experts on here. I know that, you know, Napa CHI, Napa CHI has been doing this work a long time. United Way, you've been doing this work a long time, both nationally and in California. There's a lot of expertise among you that I think is really important for Sierra Health and the platform that they're providing. So I'm hoping that you all also talk to each other about the real scoop, right? Like what is realistic given the time that we have. But with that, what I would also like to do is just talk through maybe a couple of these challenges and come up with some real solutions. So who would be interested in working on talking through sort of what are, let's say, our top 2 challenges here that we can actually solve together as a group right now with the expertise on the phone that we have?
Heather, this is Teresa. When I'm looking at language barriers, I think that is kind of I know that within my own organization, our staff, we have no English is a second language to anyone. We're all just English speakers. So I'm hoping that partnering with an agency that does have the capacity to provide communication with people of different backgrounds and language, that we can partner with them. And in my grant that we wrote for you guys, we are going to be working closely with an organization that has that capacity and works in Lassen County. So those are both 2 great positives. But that's what I would do as far as a best practice, is find a local organization that has the capacity to work with people of different languages.
And in that same vein, is anybody using a language line of any kind that they could recommend as well? I know there's an expense involved in that, but just wondering if, I think I saw, was it Lori? I'm not sure who shook their head just now, but if you have a language line, you can either put it in the chat so other folks can check that out or look into it. I think that's a great call, Teresa, because that's going to be one of the first problems that come up when you're starting to do outreach. What's another problem we can solve right now? I have one that I'd like to introduce that isn't on here, but that is to get trained. If you are not certified already, get plugged in to becoming a certified application agency so that you can submit applications. So that's one that can start right now.
I think something that can, Sorry.
Yeah.
Something that can go along with training is like the health insurance literacy. So like a lot of our clients, when they get notifications from the county or the health insurance program, even if it's in their own language, because the wording that is used, you know, our job is to simplify that for them. So just being aware of, you know, incorporating that into the training to, you know, use language that our clients can also understand.
I love that point. It's to make it accessible to them. Yes, and any links that you'd like to put in the chat, let's do that as well around that. I think that is so important because you just want to meet them where they are and convey what they need to do in order to take action. You have your day job and you have your expertise. Consumers don't have to know everything you know. They need to know you. They need to know that you're the trusted messenger and that you know your stuff. And they need to know what they need to do next. They need to get back to their lives. So I think that is a really important point. Let's do this a little bit longer. What are some other problems we can solve right now with the expertise on this call that you can knock off your list?
Yeah. I'm sorry. The internet connectivity is a huge one because as we're doing applications with folks from rural areas, the answer to that, and I don't know, I'm pretty sure that, because we serve 9 counties up here in the North State, but broadband 211 is also an opportunity for you to allow your clients to have access to internet. So it's like a $10 cost, and there's various carriers that are involved with that program, but it's called broadband, and I can email Madeline the information on that so that you can share that out.
Great. That's fantastic. Sarah's got a jam-packed agenda here for us. I don't know if the circle's working, but we're all good there. So I love that, broadband 211. Any other ideas around the tech solve? Okay. Well, I definitely think, Madeline, we should follow up with that one. And let's talk, is there one other problem that we can solve right now to take it off your 3 a.m. overnight list? We can't control the weather, so we can't solve that one. So you can knock that off. We cannot control COVID-19, no matter how hard we try. We can wear masks. We cannot make the virus stop.
Make the fear. By knowing that all of the intelligence and experience is right here in the room.
Namaste. Yes, I think that's right. Knowing that you have each other, frankly, to lean on. You do not have to do this alone, and you shouldn't. And I think that what Sierra Health is setting up for you all right now is really an important platform to be able to build a learning community within and around. And who knows where it could lead. You all could become really a nexus for expertise that could lead to many best practices in this part of the state. So we're excited to see where this goes. Just to get back to my head, heart, and feelings. And I know, Madeline, we have to hand this over to you, but are there any other problems that we missed that can be solved right now? Any that aren't on this list? So here's what I would challenge each of you to do. Take this back to your staff, this activity. Take it to partners that you're trying to build relationships with. There is power in getting the problems on the table and really focusing in on what we can solve right now. And if you don't have the answer, you know someone who does. And that can be a very empowering platform by which to start these relationships. So I think with that, I'm wrapped up here. Madeline, I'll hand it back to you, and I look forward to talking with each of you further.
Thanks, Heather and Sarah and everyone. It's really great to hear kind of the free-flowing thoughts and that collaborative spirit to put all those challenges and potential solutions on the table. And I think one thing I want to just highlight is that part of why we have connected with all of you is because you know and are of your communities. And so I think one of your strengths is that you are the organizations who are working closely with your communities and your community partners, and there's so much knowledge and to be had at the community level with the folks that you are working with and the folks that you are serving, and you are connected. So so I think that that's, you know, so powerful, and I just wanted to highlight that. That's why we work with community-based organizations, because you can go deep and you can go wide and you do such great, powerful work. I wanted to offer up just in our last couple of minutes next steps. So we keep talking about these one-on-ones. So our next step is to have one-on-one conversations with each of the organizations and your teams, talk a little bit more about action planning in those meetings and kind of what our next steps are for the work that you're doing and what your plans are. And then we'll go even deeper in January. And so so we'll be contacting you all to kind of set those up at people's schedules. I know all of you have, I think everyone has talked with Harvey Evaluation now on doing that needs assessment on the data collection. We'll get those next steps around the data to you as well. Does anybody else, and I see people are putting some great resources into the chat box, so thank you so much. I also want to offer up myself as a way for, if you have any resources or anything that you want to share, feel free to send them to me in an email and I can share them with the group. One of the things we'd also like to do is to create a contact list for everybody, but I wanted to make sure I had your permission to share your contact information. So if you are uncomfortable with your information being shared, just send me a message and I'll make sure to note that and make sure that I'm not just blasting everyone with your home phone number or something. I wanted to just give a chance. We have 5 minutes left. If we have any last thoughts. You know, we talked about what we were thinking and what we were feeling and what our action steps were. Does anybody have any last thoughts or feelings or action steps that they want to share with the group? I won't be mean and pick on anybody, but so
sorry, real quick. I just wanted to thank Heather for walking us through that exercise of the SMART goals. I think, you know, really, it's something we've been thinking about, but it's kind of got me brainstorming in my head now of, you know, things to do with specifically with Solano County. So just thank you for walking us through that.
I love SMART goals. Happy to do it. Yeah, it can be a fun way to engage people too.
So yes, thank you. And thank you to everyone for participating today. We look forward to continuing this work over the next year and some change. And I hope that everyone has a wonderful, healthy, safe Thanksgiving next week, and that you all get a little rest too. So thank you, and I hope everyone has a good rest of your day.
Thank you.
Thanks.